We are back with more What's Now, and it's very important that you stay up to date with your cancer screenings even during this pandemic. So if you're concerned about going to see your doctor because of COVID-19, well, you shouldn't be, and this is why you absolutely should still be going to get those regular screenings.
In light of COVID-19, over 1/3 of Americans have missed scheduled cancer screening appointments, according to the Prevent Cancer Foundation. While taking proper precautions to ensure we're staying safe is needed during this time, it's also important to stay in touch with your doctor if you're living with a cancer diagnosis. Here with advice for men with advanced prostate cancer to talk about the importance of regular screening and treatments is Dr. Nicholas Vogelzang, medical oncologist at Comprehensive Cancer Centers of Nevada in Las Vegas, Nevada. Dr. Vogelzang, thanks for joining us here on Park State Television.
My pleasure. Thanks for having me this morning, Christine.
So what are some of the unique challenges that men with prostate cancer are facing during this pandemic?
The pandemic has reminded us that men with prostate cancer, generally men who are over the age of 70, and generally men who have comorbidities such as heart disease, lung disease, and other risk factors for COVID are often more unwilling to come in to see the doctor. That unwillingness is often translated into wanting to stay home. And I would remind everyone that their unwillingness to stay home is not healthy. We have telehealth now. We can get you visited by your doctor by this wonderful media called telehealth. You can get your blood test done, and we can arrange for you to be seen by your doctor and have your blood test done without having to leave your home, or at least hopefully not having to leave your home very much. Those are the real take-home messages. Prostate cancer does not sit still. It's still a disease that is life-threatening and needs to be monitored on a regular basis. It's sad to see people stay home and be fearful. You have to deal with the prostate cancer, especially the cancer that is spread outside of the prostate. We call that mcrpc, and it needs to be addressed in a consistent and vigorous way by your oncology team on a regular basis. It's just important to your good health. And that's the message we're trying to get across today.
Tell me more about mcrpc and what are common signs and symptoms?
So it means that the cancer from the prostate has spread into another organ of your body. I use that analogy to say that if you take a Cadillac and put it in Japan, it does not become a Toyota or a Lexus. It's still a Cadillac. And a prostate cancer cell that spreads into the bone is not a bone cancer. It's still a prostate cancer. That means we treat it like prostate cancer, and it has a particular way in which we treat. The Food and Drug Administration has approved a large number of drugs for the treatment of that cancer of the prostate. There's a variety of hormone pills, a variety of new drugs. We call them PARP, P-A-R-P inhibitors. There's a variety of chemotherapy drugs. There's immune treatments, and there's a new drug called, or not a new drug, but a drug called Xofigo. And that drug is relatively underutilized, and we're encouraging men to use that drug once a month for 6 treatments. That goes through the vein into the bone and kills cancer in the bone. Now, it does not work for cancer in the lymph nodes. So in conjunction with your physician, that decision has to be made which is the right drug to use for your cancer at the time of your cancer getting slightly worse. And that has to be a decision made by your oncologist. Now in Salt Lake City, I have a lot of friends in Salt Lake City, both at the Huntsman, but also in Utah Oncology. That is a very good set of doctors, and those are the physicians who you should be consulting with regarding your cancer as to when to use those drugs and in what sequence. That's what we tell people all the time. Check with your doctor as to when these drugs should be used.
And how can men with mcrpc proactively manage their disease despite social restrictions and limitations due to the pandemic?
Excellent question, Christine. Again, I would state what we've already said, namely, make certain you don't ignore your visits, attend your telehealth visits. Generally speaking, you need to have your PSA checked before you go to your telehealth visit. Make certain that if you've not been diagnosed with prostate cancer, you have your annual PSA testing done. That's another component of all this. But most importantly, if you're a cancer patient, do not fear the COVID. We can find ways in which you can be managed successfully in spite of the COVID epidemic. Oncologists are prepared and ready to accept you as a cancer risk, as a COVID risk. We know what we're doing. We don't want you to avoid the oncology clinic and the oncology service that is ready to take care of you.
And what are the available treatment options that men should consider?
Well, the available treatment options include oral therapies, which would be ideal for an epidemic such as this. Chemotherapy, some of my friends are reducing their use of chemotherapy because they don't want to increase their risk of COVID. I can understand that. Immunotherapies can be used. Xofigo does not appear to increase the risk of COVID, although we don't have a lot of information. Then we have, of course, still the need for radiation, which may or may not have an effect on COVID. So as oncologists, we are aware of the risk of COVID during cancer therapy. We take it into account, and by all means discuss this with your oncologist, both your medical radiation and your surgical oncologist. But do not avoid the cancer therapy that is needed if it is needed.
And in the few moments we have left, where can we get more information, and what advice do you have for men when speaking with their doctors about mcrpc?
Well, first of all, you're blessed with great doctors in Salt Lake City. You've got the Huntsman, you've got the oncology programs throughout the Salt Lake City area. Xofigo.com, that's X, Xofigo with the X, is a good source to go to. And really, you got to just talk to your oncologist. That's what I would recommend, and don't hesitate to talk to that oncologist. They're all very aware of all that's going on in this world.
Well, thank you so much, Dr. Nicholas Vogelzang, for talking with us today. Such important and life-saving information.
Well, thank you for having me, Christine.